diabetes, cancer, heart disease, bone and joint disorders. These 4 conditions often begin in total silence, hiding their progression until the damage is already severe. They develop over years or even decades, long before the first physical symptoms appear. By the time a patient notices something is wrong, the underlying structural damage is often extensive. The early warning signs of diabetes are notoriously easy to dismiss. This medical diagram highlights symptoms like persistent fatigue, occasional blurry vision, or an increased need to use the bathroom, complaints that many simply attribute to a busy lifestyle. Heart disease follows a similarly deceptive pattern. As shown here, it presents through peripheral issues like a nighttime cough or unexpected swelling in the feet and legs, signs that rarely suggest a cardiac emergency to the average person. We frequently treat these symptoms as isolated problems requiring different doctors. However, they are almost always the result of a single, cascading breakdown of metabolic health. Body fat is often viewed as a simple storage unit for calories, but visceral fat behaves like an invasive, inflammatory organ. Tucked deep inside the abdomen, it physically crowds and impairs the liver and heart. This tissue constantly secretes free radicals into the bloodstream. These unstable molecules strip electrons from healthy cells, causing a form of internal oxidation. This persistent oxidation fuels chronic, low-grade inflammation. Over time, this inflammation damages healthy tissue, accelerating biological aging and contributing to the cellular decay associated with Alzheimer's disease. While weight gain is the most obvious sign of obesity, the real threat is the internal environment. Underneath the skin, the body is essentially rusting from the inside out. The process typically begins with excessive carbohydrate consumption. This forces the pancreas to maintain high insulin levels, which keeps the body in a constant state of fat storage. Eventually, the body's cells stop responding to the signal. In this state of insulin resistance, the body is trapped. It cannot effectively process blood sugar, so it continues to pump out more insulin, driving further fat accumulation. This hormonal disruption directly affects cholesterol levels. Since the liver produces about 80, it is a physical barrier to movement, not a failure of willpower. As shown centrally, dysfunctional fat tissue radiates inflammatory signals to every major organ system. Following the downward arrows, this leads directly to vascular complications, fatty liver disease, and weakened cardiovascular health. Upward arrows show it eroding bone density and disrupting the reproductive system. Chronic inflammation also creates the conditions necessary for cellular mutation. This data from the National Cancer Institute illustrates the strong link between obesity and increased cancer risk across the entire body, from the brain to the colon. Obesity acts as the primary node in this network, triggering a sequence of multi-system biological failures. Counting calories alone often fails because it does not address the underlying hormonal lock. If insulin levels remain chronically high, the body stays in storage mode, regardless of how much food intake is restricted. Generic diets ignore the specific physiological variables that drive weight gain, thyroid issues, adrenal fatigue, and the established cellular resistance to insulin. Information alone is not the same as transformation. A standard meal plan provides data, but reversing a metabolic cycle requires personalized strategy, accountability, and constant monitoring. True health requires a physiological intervention at the root cause, rather than a superficial attempt to simply eat less. Reversing this damage requires a science-based strategy. Working with a certified expert coach, such as Coach B.D. Sharma, ensures the approach is specifically tailored to your metabolic profile. The return on early intervention is measured in decades of healthy life. A proactive strategy now is a trade against the alternative, years of medical debt and the physical toll of invasive surgeries. You are currently on a biological timeline. Act to resolve the root cause before the damage becomes irreversible. If not now, when? If not you, then who?